listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Today we're going to be talking about some topics that involve men and women across the world. There are 3 infections that I would like to discuss that are spread among men and women and other couples throughout the country and the world itself. These are important to address because without treatment, they will continue to spread, and this can cause some major issues for the health and safety of our communities. One infection is gonorrhea, the second infection is chlamydia, and the third infection is bacterial vaginosis. Now, gonorrhea is an STD, meaning it's a sexually transmitted infection. It's actually caused by a bacteria. So this is not a virus, it's not a fungus. Gonorrhea is a bacteria. Under a microscope, the gonorrhea actually looks like 2 bubbles next to each other. So the other name is called gonococcus or diplococcus, and that's how it can be actually diagnosed, is under a microscope. There are ways to spread it through intercourse, and this can be from men to women, women to men to men, and even women to women. The infection spreads quickly from one person to another, and it causes symptoms, including painful urination. There may be discharge, there could be swelling, there could be other symptoms such as spotting or bleeding for women, and the bacteria will continue to multiply. Now, most commonly, people think of gonorrhea as affecting the vaginal area or in the penis area. However, it can also affect the rectal area, eyes, and the throat. And in some cases, if it's not treated, the gonorrhea can spread throughout the blood and infect the joints. So this can cause an infection in an elbow or a knee or other joint in the body, and this is called septic arthritis. Now, it's very important for anyone who has symptoms to go to the doctor and get tested right away. The gonorrhea bacteria can be easily detected from a urine sample. So all you have to do is urinate in a cup. Your doctor will send it off to the lab, and within a day or 2, the results will come back either positive or negative. If you're a female and you've gone for a pelvic exam, then your doctor can do a cervical test. So this is just a swab that's done during the pap smear, and that would be sent off to the lab and gives you the same information. A positive test means that the gonorrhea DNA was detected, and that means that person needs to be treated. Luckily, gonorrhea is a bacteria which is curable, so a single dose of antibiotics will cure it. This could include an injection called Rocephin or ceftriaxone. It can also include a pill called Suprax, and there are other treatments if these are not successful. So if for some reason you can't have the injection or the pill, there are other medications, but then those are given over a week's course in order to make sure the infection is fully cleared. Now, in people who have gonorrhea, they have to tell their partner. The partner needs to be tested and treated at the same time. So, for example, if the first person goes to the doctor and she is positive, she tells her boyfriend or her husband that she's positive, he needs to be treated at the same time immediately. Otherwise, if only one person is treated, they will keep sharing the same bacteria back and forth, and they're both going to have constant symptoms. So they need to be cleared. Both of them must have negative testing for gonorrhea in order to be diagnosed as being fully cured. Now, there are ways to prevent gonorrhea, which includes using condoms during intercourse. However, this is only one method. All people should be tested for STDs at least once a year if they're having intercourse or if there's any change in their partners and so forth. Otherwise, untreated gonorrhea will cause problems including infertility. So this is an avoidable cause of infertility as long as the men and the women are treated properly. 1 dose of antibiotics, which again is very, very effective. There are children who can be born with gonorrhea. So if the mother was infected during the pregnancy and did not seek treatment or did not take the medication or was resistant, then she can pass it on to her baby. And we don't want babies born with gonorrhea because it affects their eyes. It will cause blindness, which is a very serious complication, and it's fully preventable. So we must have these individuals treated, especially during pregnancy. As soon as they find out, take the medication, which is safe during pregnancy, and that will help the mother and the baby prevent complications. Now, the second infection is chlamydia. Chlamydia is also a bacterial STD. It's only spread sexually, so this can include vaginal, anal, or oral intercourse. Oftentimes, gonorrhea and chlamydia will travel together. And what that means is chlamydia is very, very small. It's actually a microscopic organism that was for a long time not known to cause an STD. But now there are tests that are very, very accurate. It's the same test as gonorrhea, either a urine sample or it'll be a swab during a pelvic exam, and it's sent off to the lab. The results come back in a day or two, and that person will receive treatment with an antibiotic. Most commonly, it'll be azithromycin. So azithromycin is an antibiotic that will kill chlamydia with one dose. But again, the same rules apply. So that person must inform the partner must be tested, and the partner must be treated. So both people must be tested and treated at the same time, and then they must have a follow-up to ensure that it is cured completely. Chlamydia has similar symptoms to gonorrhea. There can be a discharge, odor, sometimes there's burning, swelling, or bleeding, and this can be true for men and women both. Now, in these situations, chlamydia can also be spread to the newborn infant. So we need to protect the mother, and again, we need to protect the baby. So chlamydia can be spread from mother to child at the time of delivery. Untreated chlamydia causes pelvic inflammatory disease, which can also be caused by gonorrhea. This causes a severe infection that affects the uterus, the ovaries, and the internal organs of a woman. And this can result in hospitalization and permanent infertility. So this is something very, very important. It must be treated as soon as possible. In some cases, there is scar tissue that can develop. So scar tissue that develops in the fallopian tubes, either from gonorrhea or chlamydia, will increase the risk of ectopic or tubal pregnancies. So these are pregnancies where the egg cell is migrating, but it gets stuck because there's too much scar tissue in the fallopian tube, and the sperm cell will meet the egg cell in the fallopian tube, causing an ectopic or a tubal pregnancy. And that is a life-threatening emergency. This is preventable. So women who have gonorrhea or chlamydia, if they're treated, it will cut down on their risk of developing ectopic pregnancies, and it will cut down on miscarriages and abortions that are related to that. Okay, so gonorrhea and chlamydia, two very, very common bacterial STDs. They are both fully curable. Now, the third one is called bacterial vaginosis. This is a bacteria that overgrows in the vaginal area, but it's not technically an STD because it can occur in women who've never had intercourse. Usually it affects healthy women between the ages of 15 and 44, but it can occur at any age. Oftentimes women will have a discharge or an odor, and the odor feels very uncomfortable. Women become very self-conscious because the discharge gets on their clothing. They will go to the doctor, and there may be some testing that's done, either a wet mount, which is an examination under a microscope, or some other testing that can confirm if it's there. Pregnant women who develop bacterial vaginosis, also called BV, must be treated. Otherwise, it has a high risk of causing preterm labor, and those babies will be born premature, or they will have a very low birth weight, meaning the baby weighs less than 5.5 pounds. So bacterial infections in the vaginal area must be treated in order to prevent complications, again, for the baby, whether it's a premature delivery or being underweight. The people who have BV will go to the doctor, whether it's a family doctor, a gynecologist, urgent care, and they will take an antibiotic. There are several that are effective, including Flagyl, also called metronidazole, or clindamycin. And these come either as pills or as gels, which can be inserted vaginally. So common names include Metrogel, the pills are called metronidazole, and there's clindamycin. So there are several different options that are safe and effective at treating the BV, or the bacterial vaginosis, in order to eliminate it. Now, men technically don't get BV because they don't have vaginosis, but they could spread it back and forth, especially if there's multiple partners involved or if there are other risk factors. So that's why we group this in with STDs. Even though technically it's not an STD, a lot of women may have a discharge and they are not sure. Is it due to gonorrhea, chlamydia, or BV? And that's why we test for all three whenever possible. I'll have a blog with additional information, including links to the CDC and some of the American health organizations that are promoting awareness and treatment. I highly recommend that any woman or any man who has symptoms talk to your doctor, go to an urgent care, go to Planned Parenthood or any other similar clinic. They will offer you STD testing. Many sites will do it for free if they're run by the city or the county health department, because we are having an epidemic of these problems currently across the United States and by definition also across the world. So the only thing you need to do is go and get tested. Urinate in a cup. They'll check for gonorrhea and chlamydia. If you're a female, they'll check you for bacterial vaginosis. If any of those are positive, a round of antibiotics will solve the problem in most cases, and then you won't have to deal with that down the road. So I hope you learned a little bit of information about gonorrhea, chlamydia, and bacterial vaginosis. You can give us some feedback on our Facebook page, and I'll be sure to answer any questions on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3&Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.